Atorvastatin. Atorvastatin, a drug used to lower cholesterol levels, was first synthesized in 1985 by a team of scientists at Pfizer's research facility in Kent, England. The drug was developed through a multi-step process that involved synthesizing and testing many different compounds before settling on the final product. The team's goal was to develop a drug that would effectively lower cholesterol levels without causing significant side effects. They succeeded in this goal, and in 1996, atorvastatin was approved for use by the U.S. Food and Drug Administration (FDA), under the brand name Lipitor. It became one of the most widely prescribed drugs in history and is still commonly used today. Before the invention of atorvastatin, the primary treatments for high cholesterol levels were dietary changes, exercise, and other lifestyle changes such as weight loss and smoking cessation. In addition, drugs such as bile acid sequestrants, for example, cholestyramine and cholestyramine, fibric acid derivatives, for example, gemfibrozil and fenofibrate, and niacin were also used to treat high cholesterol levels. What are the indications for the use of atorvastatin? Atorvastatin is a medication used to lower cholesterol and triglyceride levels in the blood. It is typically used to treat hyperlipidemia, high levels of lipids in the blood, and to prevent cardiovascular disease, including heart attacks and strokes. Atorvastatin is often prescribed for people who have a history of heart disease, diabetes, or other risk factors for cardiovascular disease, as well as for people who have high levels of LDL cholesterol, bad cholesterol, and low levels of HDL cholesterol, good cholesterol. It can also be used in combination with other cholesterol-lowering medications and lifestyle changes, such as diet and exercise. Lipids are a diverse group of naturally occurring molecules that are defined by their solubility in nonpolar solvents, such as oil or hexane. Lipids include fats, waxes, sterols, fat-soluble vitamins, such as vitamins A, D, E, and K, monoglycerides, diglycerides, triglycerides, phospholipids, and others. Fats, also called triglycerides, are a type of lipid composed of a glycerol backbone and 3 fatty acid groups. Fats can be solid or liquid at room temperature and are an important energy source for many organisms. Cholesterol. Cholesterol is a type of steroid and is classified as a lipid. It is a structural component of cell membranes and is required for the synthesis of steroid hormones, bile acids, and vitamin D. Cholesterol is found in animal-based foods and can also be produced by the body. Elevated levels of cholesterol in the blood, especially LDL cholesterol, is a major risk factor for heart disease. Why high levels of cholesterol is bad for health? High levels of cholesterol in the blood can increase the risk of heart disease and stroke because it can contribute to the buildup of plaques in the arteries, which can obstruct blood flow. LDL, low-density lipoprotein, cholesterol, also known as bad cholesterol, is particularly harmful when it is in high levels, because it can cause the buildup of plaques in the blood vessels. HDL, high-density lipoprotein, cholesterol, or good cholesterol, can help remove LDL from the blood vessels. So having high levels of HDL can help lower the risk of heart disease and stroke. Mode of action. Atorvastatin is a type of drug called a statin. It works by blocking an enzyme in the liver called HMG-CoA reductase, which is responsible for producing cholesterol. By inhibiting this enzyme, atorvastatin reduces the amount of cholesterol produced by the liver, which leads to lower levels of LDL, bad cholesterol, in the bloodstream and a reduction in the risk of heart disease. One of the effects of atorvastatin is to increase levels of HDL, or good cholesterol, in the blood. This is because statins work by reducing the production of LDL, or bad cholesterol, in the liver, which in turn leads to an increase in the levels of HDL. Additionally, atorvastatin has also been found to have anti-inflammatory and antioxidant effects, which help reducing the progression of atheroma. the underlying lesion responsible for formation of plaque in the blood vessels. Dosage of atorvastatin. The recommended starting dose of atorvastatin for most adults is 10 to 20 mg once daily. However, the dosage can range from 10 mg to 80 mg once daily depending on the individual's cholesterol levels and response to treatment. It's always best to follow your doctor's or healthcare professional's instructions and guidance on the appropriate dosage for you. Use in children. Atorvastatin, a medication used to lower cholesterol levels, is not typically prescribed for children. The safety and effectiveness of atorvastatin in children have not been well established. And there are other cholesterol-lowering medications that are more commonly used in pediatric patients. However, in rare cases, a doctor may prescribe atorvastatin for a child under close supervision. Usage during pregnancy and breastfeeding. Atorvastatin is a medication used to lower cholesterol levels in the blood. It is classified as a pregnancy category X drug, which means that it is not safe to use during pregnancy. Pregnancy. Women who are pregnant or planning to become pregnant should not take atorvastatin, as it can cause serious harm to a developing fetus. If a woman becomes pregnant while taking atorvastatin, she should stop taking the medication and speak with her doctor about alternative treatment options. Atorvastatin, like many medications, can be excreted in human milk. Therefore, the decision to use atorvastatin in breastfeeding women should be based on a risk-benefit assessment for the individual woman. It's always recommended to consult with a healthcare provider before taking any medication while breastfeeding. They will be able to evaluate the potential benefits and risks and make a recommendation that is tailored to the individual woman's situation. The ideal time to take atorvastatin is typically in the evening, as it is a medication that can be taken once daily. It should be taken at the same time every day to maintain consistent levels in the blood. It can be taken with or without food, but taking it with a meal may help to reduce stomach upset. However, it is important to note that if you're taking it with a meal that is high in fat, the drug may not be as effective. You should always follow the dosage and timing instructions provided by your doctor or pharmacist. And if you experience any side effects or have any questions or concerns, please do not hesitate to reach out to your healthcare provider. Side effects. Atorvastatin is a medication that is used to lower cholesterol levels. Common side effects of atorvastatin include headache, muscle pain, stomach pain, and nausea. Other possible side effects include constipation, diarrhea, and gas. In rare cases, atorvastatin can cause more serious side effects such as liver damage, severe muscle damage, and an increased risk of diabetes. If you experience any unusual symptoms after taking atorvastatin, it's important to contact your doctor. Drug interactions. Atorvastatin, a medication used to lower cholesterol levels, can interact with certain drugs and foods. Some examples of drug interactions include taking atorvastatin with certain blood thinners, such as warfarin, can increase the risk of bleeding. Taking atorvastatin with a class of drugs called fibrates, such as gemfibrozil, can increase the risk of muscle injury. Taking atorvastatin with certain immunosuppressant drugs, such as cyclosporin, can increase the risk of kidney damage. As for food interactions, the absorption of atorvastatin may be reduced if taken with high-fat meals. So it's advised to take it before bedtime on empty stomach. It is important to tell your doctor about all the medications and supplements you take, including over-the-counter drugs and herbal supplements, to help prevent any potential interactions while on medication. While taking atorvastatin, it is important to keep regular doctor appointments so that your progress can be checked. Tell your doctor if you are pregnant, planning to become pregnant, or breastfeeding. Tell your doctor if you have any history of liver disease, kidney disease, or diabetes. Let your doctor know if you have any muscle pain, tenderness, or weakness, especially if you have a fever or feel more tired than usual. Avoid drinking large amounts of grapefruit juice while taking atorvastatin as it can increase the risk of side effects. Avoid consuming alcohol excessively, it could increase the risk of liver problems. Inform your doctor before taking any new medication, including prescription and over-the-counter medications, vitamins, and herbal supplements, as these can interact with atorvastatin. It is also important to remember to take atorvastatin at the same time each day, and to continue taking it as prescribed even if you feel well, as atorvastatin works best when there is a consistent level in your blood. Alternative drugs available. Atorvastatin is a medication in the class of drugs known as statins. Some alternative drugs that belong to this same class and can be used to lower cholesterol levels include rosuvastatin, Crestor, simvastatin, Zocor, pravastatin, Pravachol, lovastatin, Mevacor, fluvastatin, Lescol, pitavastatin, Livalo. Other classes of drugs that can also be used to lower cholesterol include bile acid sequestrants, niacin, and fibric acid derivatives. It's important to note that the choice of medication will depend on the individual patient and their unique medical profile and history. You should always consult with a doctor or a healthcare professional before making any changes to your medication regimen. Atorvastatin is a member of the statin class of cholesterol-lowering drugs, which also includes other drugs such as simvastatin, rosuvastatin, and pravastatin. These drugs work by inhibiting the enzyme HMG-CoA reductase, which is involved in the production of cholesterol in the liver. In clinical trials, atorvastatin has been shown to be effective at lowering LDL cholesterol levels and reducing the risk of cardiovascular events. It also has been shown to lower the risk of stroke and heart attack. Atorvastatin has been shown to be more potent than some other statins, such as simvastatin and pravastatin. Rosuvastatin and atorvastatin are both generally more potent than other statins and considered more effective at lowering LDL cholesterol levels. However, the specific drug choice and dosing regimen will depend on the individual patient and should be determined by a healthcare professional based on the patient's specific medical history and condition.